Good morning, YouTube. This morning we are going to talk about a lot of little things, this and that I have picked up over the years that I think is going to help a lot of people. Um, no set agenda, just a lot of little tricks. Let me start by saying I am not a physician. I am not a nurse. I am not a lot of things. Before you start any healthcare routine, any healthcare exercises, anything, you need to consult your healthcare provider, your nutritionist, your therapist, your whoever you are dealing with. Do not take my word as what I am giving you. The reason I am on here is this is what has worked for me during the past 39 and a half years. I am just passing what has worked for me on to you. What I will also tell you is I have a biology degree. I have a minor in biochem. I have a psychology degree. I have a cognitive behavior therapist certificate. With those, I have gained a lot of knowledge. I retired from a level 1 trauma department. I've had a lot of nutritional classes. I've had a lot of biology classes. I've had a lot of med classes. I've had a lot of pharmaceutical classes. It still does not give me the right to tell you what to do. You know what medications you're on. You know how your body reacts to certain things. With that being said, I know what medication I'm on. I know how to take or what reacts to my medication in my body. This is nothing more than knowledge. So, with that being said, I am going to give you the knowledge that I have learned over the past 39 years, just so you have knowledge, so you can make up your mind. You consult your physician and say, can I do this? So we will go on from there. Last week, breathing wise, I started y'all on the 444 method. This week, I want y'all to move that up a notch, going to up 1, 5, 5, 5. So inhale, taking that up to 5, go 1, 2, 3, 4, 5, hold for 5, exhale, inhale for 5, hold for 5, exhale for 5. This week, practice that instead of 4, 4, 4, 4, make it 5, 5, 5. So each week we'll go up one more. That'll improve your respiratory system, your lungs, to make it easier to breathe. Next, we'll go better for your migraines. A lot of migraines are just increased by stress. So one of the things that work best, you're going to find this very funny. This is an octopus. At Walmart, they sell for $4.87. It comes in a box of 3, I think. I'll show y'all. There's a red one and a green one in here. Put one in your car. They don't melt. Put one in your bedroom. You can put the other one in your purse if a girl, or one at work. If you get stressed, instead of smoking a cigarette, which will make your head worse, see this? They're not going to melt. They may stay out. You can push them back in. Sit there and squeeze a ball. They're a little stress ball. That's all they are. Or you can do the rubber band trick. Might hurt your hand after a little while, but this is much safer. Nothing more than a little stress ball. Plus it looks funny and it's cute. Also, best known trick to man. Also, it's also $4.87 or $4.50 or something like this. I like lavender oil. Vanilla works, but the best one to get that works is actually eucalyptus oil. If you can slow your breaths down like I did with the meditation, take the eucalyptus oil, clear your mind, close your eyes, put it right under your nose and go. Move it away. Exhale. The more you can inhale that in and hold it and blow it out. I was actually using the wrong kind of oil. When I went to Fort Jackson, I had a migraine. I was going there to pick up my meds. A pharmacist saw that I had a migraine. He could tell in my eyes. And he was like, stay right here. I want to show you something. Pharmacist had migraines. He set me down and had me close my eyes and take a whiff of the eucalyptus oil. Within 10 seconds, it was better. If you slow your breath down and inhale it, there's something in this eucalyptus oil. Make sure you're not driving because you'll get like a rush. It will open up your veins. I kid you not. Next, I'm not pregnant. When you see this, you're going to laugh. Yes, there's a stork on these journals. There's pages, but one of them says a headache and migraine journal. The other one says triggers. There's a reason for that. I've got cookbooks over here. One of them says migraine diet. The other one is written by Travis Stork. And that is the reason there's stork on these journals. Is because Travis Stork wrote that cookbook. But you can get any books you want. What I recommend you doing is, if you have a migraine, write a journal. When your migraines come on, what time of the day? Mine usually come on in between 2 and 4 o'clock in the afternoon. They're brought on by sun or by noise. What makes them better? What makes them worse? If you have food triggers, if you have any other kind of triggers, write those down. They're great to find out for your doctor so he knows. If you write any other kind of triggers, for me, like perfume, I cannot wear any type of girls' perfume. I can only wear men's perfume, any like flowery perfume or roses or anything like that. But like I said, earthy perfume, like men's perfume, I'm fine with. But if they're allergy testing me right now to see if I'm allergic to anything else that I unwittingly am walking into. Like outside, I found out I'm allergic to the dogwood tree. We're having to cut that down. So anything useful that you can write down in your migraine journal. Detergent. I had to change detergents. That can change your life and make it better. That's something, molds, mildew, you might need to change, any type of cleaner, anything like that. That you can write down in your journal that can make your life easier. Write down in there. One thing, some medicines give you tinnitus. There is something called lipoflavoid that you can get in the drugstore that will make your tinnitus better. Also, if you have tinnitus, if you focus on a fan running, for some reason that's psychosomatic, if you focus on something else, it will kind of drown out you not focusing on that inner ringing of your ears. The other thing, two more things really quick. If you do not have this, you need to go get it. It is a self-care journal. There's so many things to do in here if you are a migraine patient. You need to be taking care of yourself. It's just little things you can do every single day to take care of yourself. Just little things every single day to take care of yourself. Just 15-minute things to take care of yourself. Everybody needs a self-care journal, whether you have a migraine or not. Okay? The other thing, it's very easy to wallow in pain if you are a migraine patient, because you're waking up in pain, you're going to bed in pain. So it's very easy to do. Go and get a gratitude journal. I advise everybody every single morning to get up and just write down 3 things that you are thankful for. Just 3 things. They cannot be the 3 things every single day over and over and over again. Just 3 things every single day that are different, not the 3 things every single day. Write them down. 2 more things. This is the most important thing in the house that you own. Water. You need to be drinking water every single day. Have it in your hand, because if you are a migraine patient and you take migraine meds, those migraine meds are depleting you of water. They are pulling water out of your body. You need to be replacing that water. This needs to be in your hand every single moment that you are awake. Last but not least, you need to get the Morton's iodized salt out of your house, unless you are making homemade bread and it calls for iodized salt. There are 2 kinds of salt you need to have in your house. There is pink Himalayan salt and there is Celtic sea salt. Now, there is a difference between these 2 salts. Pink Himalayan salt is great to season with, and it is detoxing your body. Celtic sea salt, and there's a difference between Celtic sea salt and regular sea salt. Regular sea salt tastes like the sea and has a very salty taste. Celtic sea salt has a lower sodium milligrams than regular sea salt, and it's great for migraine patients. Okay? Great for your body. Now, if you're a kidney patient like me, you need to discuss with your kidney doctor which one you need to do. This one, if you've heard of the pink salt remedy, is also good for weight loss. This one is great for migraine patients. Now, whether or not you can switch this one off for the pink salt recipe for weight loss, I have no idea. I'm not for that. I'm not an actual chemist, so I don't know. I do know if you're a low sodium diet, you don't need to be eating a bunch of either of these. However, if you are a migraine patient, no matter which one you choose to do, you do need salt in your diet to be making red blood cells so you do not become anemic. Because if you don't continue to make red blood cells, guess what? You're going to get a migraine. So it's a continuing path. So I hope we covered enough information today. I will be back with another video. I know this was a long one, but I wanted to get a lot of information out there. I will be back at the beginning of the week. Sorry I wasn't here all this week. It was a really busy, busy week. Had my MRI this week. So I will talk to y'all soon. Have a good weekend. Thanks. Bye.